One of the most frequent information-giving queries I receive from experienced international medical graduates preparing for OET Speaking goes like this. When a card asks me to explain a complex test, like an endoscopy or an MRI, I end up giving a massive 2-minute lecture full of medical jargon because I want to make sure I cover all the clinical details. But the patient stops me, looks terrified, and I run out of time. Am I losing marks for over-explaining? Holding this belief introduces an immediate high-risk liability under official marking criteria. Thousands of capable doctors treat OET explanation stages as an academic Viva jargon dump. When required to explain a test, candidate doctors panic, dump dense technical jargon onto an anxious patient, and trigger immediate cognitive overload. As you can see on your display, medical encyclopedic knowledge is not graded. You do not score points by proving how much medical knowledge you have. In reality, dense jargon triggers cognitive overload and penalizes providing structure. Let's take a look forensically at why over-explaining procedures damages your scorecard and how to execute your explanation phase using our 3-step procedure roadmap. Now, why do highly articulate candidates consistently over-explain medical procedures during OET roleplays? It stems directly from what we define as the medical school reflex, real-world conditioning built on an academic Viva mentality. In tertiary hospitals or academic exams, your medical license required exhaustive clinical detail. Hospital ward habits train doctors to prove medical knowledge to consultants. Under the psychological pressure of a timed examination, that academic instinct hijacks your communication mechanics. When a patient asks, "What actually happens during an endoscopy?" candidates panic and deploy this exact high-risk habit. Well, we pass a flexible gastrointestinal endoscope through your oropharynx, down the esophagus, past the lower esophageal sphincter to inspect the mucosal lining of your duodenum. Look at the severe scorecard penalties this habit inflicts. Scorecard penalty 1, cognitive overload, terrifies an anxious patient with intimidating anatomical jargon and complex pathophysiology. Scorecard penalty 2, criteria deduction, fails providing structure and information giving by dumping text without chunking. Scorecard penalty 3, timeline collapse, forces patient clarification interruptions in stage 3, causing a severe timing leak. Remember, OET evaluates patient-centered clarity. To eliminate this liability, you must understand how OET assessors actively evaluate your performance on test day under our rubric evaluation framework. Look at the official assessor directive on your screen. When a candidate delivers an unstructured jargon dump, the interlocutor is explicitly instructed to express confusion or ask redundant questions, dropping your score across providing structure and patient perspective. Under official roleplay directives, this triggers forced confusion. The interlocutor must interrupt unchunked lectures with clarification requests, breaking your momentum. This results in a brutal rubric impact, double penalty, triggering simultaneous score deductions under both providing structure and patient's perspective. The senior solution is Band 5 architecture. A 3-step plain language roadmap re-establishes clinical leadership and secures top rubric bands. Now, here is the reality. Assessors evaluate dynamic, patient-centered information architecture, not medical encyclopedic detail. To explain complex medical procedures without losing structural control of the consultation, you must replace medical jargon with a fixed operational framework. We call this the 3-step procedure roadmap. This structured antidote operates across 3 deliberate clinical steps. Step 1, simplify the scope. Define the procedure in one simple, non-intimidating sentence using clear, everyday language. Lead in with this. An endoscopy is very straightforward, Mrs. Clark. Step 2, sequence the sequence. Chunk chronologically into clear phases using explicit signposts. First, second, third. Signpost your structure like First, we gently numb your throat. Second, a tiny camera. Step 3. Anchor the outcome. Conclude with the immediate, comforting next step or discharge plan to relieve anxiety. Use this reassurance anchor. And third, once complete, you go home the same afternoon. The goal is to neutralize patient anxiety, protect timeline runway, and secure Stage 3 collaborative management. Here is the Masterclass standard script you deploy during information giving when explaining a procedure like an endoscopy. Observe the strategic phrasing and cadence markers. An endoscopy is very straightforward, Mrs. Clark. First, we gently numb your throat. Second, a tiny camera checks your stomach. And third, you go home the same afternoon. Examine the architectural precision of this exchange, mapped across our rubric criteria. Very straightforward, instantly clears patient anxiety and satisfies incorporating patient perspective. First, second, third, establishes explicit information hierarchy for top-tier structural marking. Go home the same afternoon. Anchors immediate discharge plan and prevents timeline draining follow-up questions. This framework demonstrates profound clinical clarity while keeping your consultation moving predictably towards safety netting. Now, executing the script is only half the requirement. Your phonetic delivery determines whether you project clinical authority or panic. To master this protocol, you must enforce 3 specific vocal mechanics. Chunking silence. Enforce a brief micropause between signposts. Rushing sounds like an anxious list. Pacing deceleration. Slow down talking speed by 10% when describing physical steps. An unhurried delivery projects complete clinical composure. The consultant drop. Lower your pitch and chin on the final syllable. Go home the same afternoon to signal decisive clinical completion. These vocal mechanics determine whether your explanation projects senior clinical authority or internal exam panic. Structuring procedure explanations protects your marks under providing structure during information giving. However, you must view this skill within your macro timeline control and velocity framework. Look at our 5-minute consultation masterclass architecture. The first minute, stage 1, clinical control. Minute 1 to minute 3, stage 2, targeted exclusion, bringing you directly to the 3-minute hard ceiling. From minute 3 to minute 5, stage 3, collaborative management, including your final sweep at 4 minute 30 seconds. If you fall into the defensive medical pitfall and give an unstructured 2-minute lecture, sprawling history or dense jargon dumps trigger patient confusion and clarification interruptions. This bleeds time in stage 2, targeted exclusion, triggers a providing structure penalty, and leads directly to scrambling and timeline collapse. Conversely, our masterclass protocol, the 3-step procedure roadmap, chunking explanations into a 3-step sequence, keeps stage 3 tight, prevents patient confusion, and locks stage 3 velocity. This preserves your final sweep and protects your safety netting. This procedure structure isn't just about clarity, it protects your 5-minute timeline runway. Now, I want to evaluate your consultation, and I mean it. I would like you to drop a comment below. Which specific procedure, MRI, endoscopy, or lumbar puncture, causes you to over-explain when nervous? Tell me your exact communication friction points. I personally review and reply to your comments to help you troubleshoot your consultation for test day. Beyond our discussion in the comments, the most direct way to gain complete clarity on your exam readiness is to run a structural health check on your entire consultation using our free diagnostic tool, the 60-second timeline integrity audit. This tool allows you to pinpoint hidden structural leaks before test day, evaluate the exact risk of timeline collapse, and get tailored phrasing protocols to lock in velocity. Click the first link in the description below, run your free timeline integrity audit to eliminate timeline collapse, and I shall see you in the next masterclass.